pulmonary venous congestion will lead to increased pulmonary capillary wedge pressure. The increased pulmonary capillary wedge pressure can lead to pulmonary edema. This is where the disease stays for some time, but if it is continued for over a long period of time, this will lead to pulmonary arterial hypertension. And you know the consequences. If there is pulmonary arterial hypertension, this will later on lead to right ventricular hypertrophy. And if this remains for a long time, this will lead to right ventricular failure. The left atrial dilation will also cause mechanical obstruction. And so, as before, it can cause dysphagia, hoarseness, what happens particularly here, interestingly, is, as I told you, some part of the left ventricular blood goes back to left atrium. But the same blood can return back into the left ventricle during the next cardiac cycle. So, peculiarly, see, this is a cycle that is going on for months and years. So, the amount of extra blood that is going into left atrium also comes back to the left ventricle. And each time this keeps on getting added in arithmetic progression. So, there is progressive overfilling of the left ventricle as well. Due to return of the regurgitant blood in each cardiac cycle. And as this is keeping on happening, there is a left ventricular volume overload. This left ventricular volume overload will cause left ventricular hypertrophy or dilation. And as you know, any pathological hypertrophy leads to failure. So this will lead to left ventricular failure. So are these sequences of events